Nobesuthu, I want to bring you in here from Cape Town. And also there were grave concerns from graduate nurses, part of the health department's community service program. But they say they've actually been left without jobs since their program ended earlier this year. You would think that they would be desperately needed.
Certainly, Sally. So the health sector, more especially the nurses, they're saying that they are appreciative at the fact that they're being honored and celebrated and their work being recognized. But those who came from school or recently graduated and were part of a community service program last year are saying that they've been left without jobs as soon as that program ended, and they question whether the department is serious about hiring graduates. And they were saying that the department and some of the unions in the province are complaining about the fact that hospitals are understaffed and nurses are overworked and exhausted, especially working during the pandemic. But they don't understand why the department is not hiring. The MEC of Health in the province citing that they don't have the budget for now, but they will keep running their programs where graduates will get into the system, and possibly, like what I've been some of the graduates that I've been speaking to are saying that, well, those two who are coming into the program will also be left without any jobs. So I spoke to Sibonakele Mate, and this is what he had to say.
We are qualified professional nurses or registered nurses with no jobs. But now what the government does, or maybe what the hospital does, and then they provide us with agencies. And then the agencies at the moment, what they do to us, they just like private companies which employ us, and then they give us, you find that as a professional nurse, when you work, you expect per day to get 1.8. A minimum of 1.8, but now with them we find that per day they'll give us 700. Now that 700 has to be taxed too. Now with that money, if per day, just per day alone, and then if you're gonna get that money, because maybe you find that per week you're gonna work only maybe 1 day, or another week 2 days, and then another week maybe 3 days, another week maybe they don't even call you, and then now when you add that amount, it can't even add up to 2.5, and then the rent there is 2.7. And then now we find that now we are stressed, and then we are depressed, we don't know what to do. And then we did try by all means to write the memorandum, and then we send it to the Department of Health, and then they responded and say, yes, we hear it, but now the problem is that we have the limited funds, we can't employ you, we have reserved the space for the community service that we're going to employ.
So graduates saying there's just not enough money, but they're also really dependent on, because they're expected to fill in for sick nurses, aren't they?
Certainly, Sally. And another group that is also expected to work as nurses are the community healthcare workers, who are also complaining that they're not being recognized. In fact, they're saying that they want the department to absorb them because they do work as nurses. They're the first people to respond to any person in the community that is expected to be screened, and they deliver medication, but they can't be absorbed. The department saying that it also does not have enough budget to help those. But DINOSA did say that on Thursday or tomorrow they will be meeting with the provincial department to talk about some sort of like come up with resolutions as to what can happen to the graduates and the community healthcare workers.
All right. So thank you for that, Nobesuthu in Cape Town. Mawande, bringing you in here from Durban now, and you've been speaking to nursing union DINOSA in KZN. I'm wondering if they're echoing the concerns that we're hearing from your colleagues around the country.
Well, on one hand, there are celebrations, and on the other hand, there are issues that are being highlighted once again. And one of those issues that are being highlighted as far as the province is concerned is that one nurse is tasked with looking after at least 160 people in the province. This is something that DINOSA says points to an issue of personnel. They say that with the over 80 hospitals that we have in the province, there isn't really a shortage of infrastructure, but a shortage of personnel that needs to be addressed before it causes issues during the mass vaccination process. Let's listen to what Mandla Shabang of DINOSA further had to say.
But what is happening currently is that there is no production of staff, human resources a disaster, and having this situation of 100 patients to one nurse in a province, it tells you straight that nurses are overburdened by work. Nurses are burnt out. Now, the current situation in vaccination, it is being viewed as all is well because you are using the nurses that are employed in a hospital to continue doing the vaccination. Our fear is that come the time where we need to visit the community, that is where everything will be exposed because the department has not done enough in preparing for community vaccination, because there you're going to need a large number of people. Currently we are sitting at almost 8,000 vaccinators who have been trained. Those vaccinators, maybe 2% of them are coming from the community that have just been employed. The majority of them are people who have been employed in their facilities servicing patients. Now, if you're taking them out now, what are you saying with the institution if you're taking them for vaccination?
All right, so that's some views from Durban. Manqoba Mchunu, I want to bring you in. You are outside Charlotte Maxeke Hospital, and of course we know that hospital is trying to reopen after that devastating fire. Have you been able to speak to nurses and how are they feeling?
Well, certainly, Sally, I think we're hearing the same sentiments here from nurses around here in Johannesburg. Of course, the concerns around some of the issues that have been long-standing, the issue of poor working conditions, which have been exacerbated by COVID-19. Earlier on, I did also attend a seminar that was hosted by DINOSA celebrating this particular day. And one of the...
All right, we seem to have lost that link to Manqoba, but we do have a clip that Manqoba recorded earlier with a nurse. Let's take a listen to that clip and see if we can perhaps reconnect. All right, so I'm going to try one more time to get back to Manqoba. Manqoba, can you hear us? All right, no, we seem to have lost that. But one final question to Linda in studio. Linda, of course, we're all talking about the third wave. We have seen how exhausted our nurses and doctors have been by the first two waves. Were concerns raised at that symposium you attended with Nahawu about how they're going to get through the third wave?
Well, that's right, Sally. In fact, we were listening to that sermon, and one of the things that they said was that government is quite strong in coming out and saying that they are ready for the third wave, like in Gauteng, where they've displayed the number of beds that they have, the oxygen tanks and all of those things. But one of the things they've raised as a concern is that the mental health as well as the fatigue from some of the nurses is another point that is not being paid particular attention. I mean, if you look at the fact that some of those nurses that had to go and isolate because of COVID-19, you know, the ones that are left are the ones that need to cover for them. So there is a point of concern around the fatigue, as well as the hiring of nurses, saying that there's quite a number of them that are registered on the roll, but these numbers are not seen in many of these hospitals. So quite a few concerns raised about that, and a call to government to say that they must actually hire those nurses that are actually available on the roll, and particularly those that are on contracts must then be given those permanent contracts, because they deem that as exploitation, to say that there is a vacuum that needs to be filled in terms of nurses being put in these hospitals, but some of them are still on contract. So quite a few points raised there in terms of the concerns around the number of nurses and the fatigue that is plaguing the health sector.
Yeah, absolutely. Well, at least many of them have got the vaccination, so hopefully that will also help protect them if that third wave hits sooner rather than later. Lindokuhle Xulu, thank you so much. Our reporter Manqoba Mchunu, unfortunately we did lose that line. He was outside Charlotte Maxeke Hospital. Also thanks very much in Cape Town to Nobesuthu Hejana and our Durban reporter Mawande Kheswa. They're all paying tribute to nurses on International Nurses Day.